Ebola virus map is a powerful real-time dashboard designed to monitor Ebola virus disease and related hemorrhagic outbreaks across the world. What makes this platform particularly interesting is that it combines official public health information with curated news intelligence and geospatial visualization. In other words, it transforms scattered reports and epidemiological updates into a centralized analytical interface. This approach is highly valuable because infectious disease monitoring is fundamentally a data problem. Signals emerge from many different sources. Official agencies publish alerts. News organizations report local developments. Health ministries release statements. Researchers publish analyses. And dashboards like this attempt to organize all of that information into a single coherent picture. The result is a practical OSINT tool for understanding one of the world's most serious infectious diseases. It is important to clarify that the markers shown on this map do not necessarily represent confirmed cases. According to the platform's own methodology, each pin corresponds to a geolocated signal. A signal may be an official outbreak notice, a surveillance bulletin, or a credible news report associated with a specific location. This distinction is crucial. A signal is an indicator of activity. It is not automatically equivalent to a laboratory-confirmed infection. That is why responsible interpretation matters. Good analysis always begins by understanding what the data actually represents. The dashboard aggregates information from reputable institutions including the World Health Organization, the Africa Centers for Disease Control and Prevention, the Centers for Disease Control and Prevention, the European Centre for Disease Prevention and Control, and ProMed. This is an important strength. Rather than relying on a single source, the platform consolidates multiple streams of information. Cross-referencing independent sources increases analytical confidence and reduces the risk of drawing conclusions from incomplete data. To understand why Ebola receives such close attention, it helps to understand the disease itself. Ebola virus disease, often abbreviated as EVD, is a severe and frequently fatal illness caused by viruses of the genus Ebola virus. The disease is transmitted through direct contact with blood or other bodily fluids from infected individuals or contaminated materials. Symptoms often begin with fever, fatigue, headache, and muscle pain, and can progress to vomiting, diarrhea, internal bleeding, and multi-organ failure. Although Ebola is not as easily transmitted as respiratory viruses, its high case fatality rate makes early detection critically important. One of the most significant outbreaks in modern history began in West Africa in 2014. That epidemic affected primarily Guinea, Liberia, and Sierra Leone and resulted in more than 28,000 reported cases and over 11,000 deaths. Beyond the human tragedy, it demonstrated how quickly a localized outbreak can evolve into an international emergency. It also highlighted the importance of surveillance, rapid response, and transparent communication. Dashboards like this are a direct response to that lesson. They help convert fragmented information into situational awareness. Geography plays a central role in Ebola epidemiology. Historically, most outbreaks have occurred in Central and East Africa, particularly in the Democratic Republic of the Congo and Uganda. These regions contain ecological conditions believed to support the natural reservoir hosts, with fruit bats widely considered the leading candidates. Human spillover events are relatively rare, but once they occur, local healthcare capacity and public health response become decisive factors. This is why mapping tools are so useful. They reveal not only where signals are emerging, but also how geographically concentrated or dispersed they are. A cluster of reports in one district may suggest a localized event. Signals appearing across borders may indicate regional concern. The visual context can often be more informative than raw numbers alone. Another valuable feature of the dashboard is the integration of a live news feed. This allows users to move beyond the map and inspect the underlying reports. This is essential because context matters. A headline about suspected cases is very different from an official declaration of confirmed transmission. The most effective analysts read the source material rather than relying only on summaries. The platform also illustrates a broader principle of OSINT. Publicly available information, when properly organized, can provide substantial insight into complex global events. The same analytical approach used to track ships, aircraft, or supply chains can also be applied to epidemiology. The objective is not to replace official health authorities. It is to improve visibility, speed, and understanding. Another important concept is signal strength. When the same development is reported independently by multiple credible sources, confidence increases. When information appears in only one unverified article, it should be treated more cautiously. This is a core principle of intelligence analysis. Corroboration matters. The dashboard appears to categorize signals by type, distinguishing between official reports, emerging reports, and general chatter. This layered approach is useful because it helps users assess the relative reliability of each item. Official reports carry the highest confidence. Emerging reports may be credible but not yet confirmed. Chatter may indicate early awareness but requires greater skepticism. Understanding these distinctions is essential to avoiding misinterpretation. Ebola surveillance is also an exercise in understanding uncertainty. Data evolves. Case counts are revised. Suspected cases may later test negative. Geographic attribution may change as investigations proceed. A professional analyst treats all information as provisional until corroborated. This disciplined mindset is just as important as the data itself. The dashboard also highlights the role of time. Knowing where a signal occurred is useful. Knowing when it occurred is equally important. A report from several months ago may provide historical context, while a report from the last 24 hours may require closer attention. Temporal awareness is fundamental to outbreak analysis. Another reason dashboards like this are valuable is that they make public health information more accessible. Official reports are often published as technical bulletins or PDF documents. They are authoritative, but not always easy to explore quickly. A visual interface lowers the barrier to understanding and enables users to identify patterns at a glance. This democratization of information is one of the most powerful aspects of modern open data. Of course, accessibility also brings responsibility. Ebola is a serious disease, and outbreak information should be interpreted carefully and without sensationalism. Maps and dashboards are tools for situational awareness, not a substitute for professional medical advice or official public health guidance. Used responsibly, they can improve understanding and support informed discussion. Used carelessly, they can amplify confusion. That is why critical thinking is indispensable. From a strategic perspective, outbreak monitoring intersects with economics, security, and international development. Severe epidemics can disrupt healthcare systems, reduce economic activity, interrupt transportation, and strain government resources. Monitoring emerging health threats is therefore relevant not only to public health professionals, but also to analysts, journalists, researchers, and policymakers. Ebola virus map is a compelling example of how epidemiological intelligence can be presented in a clear and practical format. It combines mapping, source aggregation, and contextual reporting into a dashboard that is both accessible and analytically useful. It allows users to move from a global view to specific signals, and from those signals to the original sources. That transparency is a major strength. Ultimately, the greatest value of this platform is not the map itself. It is the perspective the map provides. Each marker represents a piece of information. Taken individually, those pieces may seem limited. Taken together, they reveal a broader picture of surveillance, response, and global health awareness. And that is what makes dashboards like this so powerful. They transform scattered data into actionable insight. They help us understand not only where events are unfolding, but how information about those events is collected, verified, and interpreted. And in a world where timely information can shape critical decisions, that capability is extraordinarily valuable. One of the most important things to understand about outbreak maps is that they show signals, not absolute certainty. A report on the map does not always mean a confirmed case. It may represent an official alert, a surveillance update, or a credible news report that requires further verification. This is why interpretation matters. The quality of the source is just as important as the information itself. Another key point is that the map reflects both the disease and the strength of the reporting system. Countries with better surveillance may appear more active simply because they detect and publish information more quickly. In other words, more visible data does not always mean more disease. It can also mean better monitoring. Ebola surveillance also shows how connected global health has become. A suspected case in a remote area can be investigated locally and reported internationally within a very short time. Ultimately, the real value of dashboards like this is that they turn complex public health information into something clear and understandable. They help us see not only where events are occurring, but also how modern surveillance systems work to detect and contain emerging threats.